Today, we're going to be talking about veterans that are going through substance abuse and need help with their claims. So we hope that you'll join us for this subject. Hi, and welcome back to Hill and Ponton's VA Disability Blog. I'm Natalia Joffrey, the company COO.
And I'm attorney Ann Linscott.
And Ann, you're in your fancy office today.
And change of scenery.
I love it. We're still, as you can tell, social distancing and having to do our videos remotely. But Ann, you actually migrated to the office today, but you're there by yourself, right? For the most part?
Just a few other people. I've got my mask right over here.
I love it. Good job. So today we're going to be talking about a little bit of a delicate subject in that, it's difficult. It can be challenging, but of course, it is possible to get benefits, but I'll let you enlighten everyone more about that. But all that is substance abuse. So I think we should start with where many times these claims begin and these problems begin, and maybe go over how common mental health claims are in the VA.
So I would say substance abuse is most common with mental health conditions. It's not the only time you'll see substance abuse, but there are a lot of mental health claims that we take and work on, and substance abuse is definitely interwoven as far as in medical history that the veteran had, or possibly ongoing. So it's not unusual. It's something that can sometimes make a claim getting the correct rating or possibly service connection more complex. But like I said, it's very common and something that we're used to working with, and definitely not something to be ashamed about if that is part of your history or your current picture. So don't worry about, filing a claim and having that. Don't let that be the reason why you're not filing a claim for a mental health condition.
Right. And how often would you say that veterans get 100% disability rating for mental health claims versus physical conditions?
I would say I've seen it definitely as far as a 100% rating through the rating criteria rather than through individual unemployability. More common in mental health claims. The rating criteria for orthopedic issues especially is very strict and hard to get those increased ratings. And so in those cases, a lot of times the 100% is coming through individual unemployability. Mental health, I would say, if you're just strictly comparing mental health getting 100% versus orthopedic, I would say mental health, I've seen more mental health conditions getting rated at 100% than orthopedic.
Okay. And how often would you say substance abuse is a factor in those mental health claims?
I don't have a number, but probably more than half.
Really?
I mean, that might be kind of overstating a bit, but it's very common to see substance abuse, whether that substance abuse was old in the past. A lot of times veterans, before they actually seek medical or psychiatric treatment, they may be self-medicating. They may not even realize that's what they're doing. And so a lot of times with, if you're proving service connection, one of the things we're looking for is it's pretty rare to actually have in-service treatment noting a mental health diagnosis, but we're looking for things like behavior changes. Did you start drinking a lot after a certain event happened? To go back to the question, I would say substance abuse is very common that we're seeing it in relation to as a factor of mental health claims.
So veterans shouldn't let the fact that they either have a substance abuse problem or have had, because we have a lot of veterans that have recovered from substance abuse problems, and sometimes they don't pursue a claim because they either don't want the VA to know about it, or they're embarrassed by it, or they feel like they'll never get an increased rating because that was a part of their past. And based on what you're telling me, that's probably not the right decision, right? I mean, if they have mental health issues and continue to have problems. We know that so oftentimes the VA does rate these claims very low, and then you often have to fight to get more. So a substance abuse issue shouldn't keep you from attempting to do that. Would you say that's accurate?
Definitely. And with substance abuse issues, the VA, a lot of times it's kind of what came first, the chicken or the egg. And that's what makes mental health and substance abuse claims complex sometimes, is you really do need to, the VA is going to try to say that the substance abuse came first and then the mental health disorder, so that they can deny and say that because substance abuse in and of itself is not a disability that can be rated, but if it increases symptoms or increases your occupational and social impairment functioning, as long as there's a doctor explaining how the substance abuse is actually either caused by or related to, just interwoven with the primary mental health diagnosis, that has to be considered when rating the severity of your condition.
Yeah. I was recently talking to your colleague, attorney Melanie Franco, and we were talking about, substance abuse and how it affects claims and whatnot. It was in PTSD cases, as a matter of fact. It was specifically to PTSD. And she was talking about how, you could, maybe you already drank, but for example, after a certain traumatic event, all of a sudden that drinking has now increased or is exasperated to the point where now it's a significant problem. And so I guess there's markers where you can tell there's a difference. And of course, just because you drink doesn't mean you're an alcoholic. So, it's making that distinction, and sometimes related to events that happened in service, that can be documented, right?
Right. Documenting it is important. And even if, in medical records, service records, you're not going to have a bunch of documentation about drinking or things like that. But if you can have buddy statements, friends and family talking about how they've seen your behavior. So if before service, a lot of people before service probably weren't at drinking age, but, if before a traumatic event happened, just a social drinker, no big problems, didn't affect someone's life very much. And then after the traumatic event happened, after service, that was no longer the case. It was frequency of drinking, increased amount, type of alcohol, all those different things. And having even just friends and family describe that, a doctor can look at that information and then say, what's being described here by friends and family, in my medical opinion, shows that the substance abuse problem is happening. So you do need that doctor to relate it, but you can have evidence coming from non-medical people to describe kind of the situation.
And so, of course, we're encouraging people that even if this has been a problem for them, that they still, look into pursuing a claim or getting their rating increased. But of course, that doesn't mean that it's going to be problem free. So what are some of the common issues that you've seen associated with substance abuse?
I'd say probably the biggest one is the VA trying to just put everything onto the substance abuse and saying that that's its own separate issue. For example, in related to occupational impairment, if a veteran lost his job because of drinking problems, substance abuse, showing up to work drunk, the VA might say, oh, yes, you have a mental condition, and yes, you're not working, but you stopped working or you can't work because of your alcohol abuse. You want a doctor to show how that alcohol abuse or any substance abuse is actually, part of the mental health condition, to show that that limitation is actually related to the condition you're service connected for. And if it's service connection, the VA will say, well, you don't have a mental health diagnosis, you really just have a substance abuse problem. Getting a doctor, again, is going to be important. Finding a doctor that really understands how different diagnoses work together, and specifically how substance abuse and mental health relate. That's going to be a lot of times what you're needing. If you're having problems with the VA rating you correctly or service connecting, and there is a potential substance abuse factor in there, then finding a doctor to get that clear cut evidence, making it as obvious as possible to the VA is what's going to help the most.
Yeah. It's funny that you say, when you said earlier, what came first, the chicken or the egg? And I know years ago, handling disability claims for veterans, for Vietnam veterans particularly, nowadays I'd like to think that we're a lot more educated, that there's a lot more support services available for veterans when they return from service. I hope that they're treated better. People now, laymen, know what PTSD is and how it affects veterans and so on and so forth. But for a lot of our Vietnam veterans, that wasn't the case at all. They were severely mistreated when they returned, or treated very, very poorly. And so, and back then, people didn't really know what PTSD was or how it manifested itself. And I think that it led to a lot of them self-medicating through drinking, through doing drugs, just to deal with life, daily, life's daily ordeals.
Yeah.
And we did and do have a large homeless population as a result. And I think that lots of times people look at them and think, well, they have a drinking problem, or he's a drunk, or he's a drug addict, and kind of like that's why they're homeless. But the reality is that many times it's these underlying health conditions like PTSD, like severe depression, like anxiety, and all of the others, that are causing them to in turn drink or do drugs. And then it leads to all of these other things like you were discussing, job loss, family issues, which can lead to them being kicked out of their homes, kicked out of places where they're staying, if they're staying with family and friends. And then if they don't have a job or any means of support, now you are homeless with a mental health condition and a substance abuse problem.
Yeah, I would say, it's definitely a cycle, and it's also interwoven that it's hard to separate everything out. And the thing with, as far as how that problem relates to VA claims, you don't necessarily have to be able to separate everything out. As with everything, the VA is supposed to give the benefit of the doubt to the veteran. It's just supposed to be at least as likely as not. So if a doctor says, look, I can't tell if what came first.
Right.
It's so a phrase that we use a lot is inextricably intertwined. That basically means it's all so mixed up. You can't really tell, and in that case, the tie goes to the veteran. So, after years and years of substance abuse, yes, that's going to impact a mental health condition, even if the mental health condition came first. But the common theme as far as what's best for these claims is getting medical evidence, treatment, obviously, but as far as winning your VA claim, getting that medical evidence to at least explain how they're related or so interwoven that you really can't tell. In those situations, the VA might deny. That's where, I can't, as a lawyer, say whether something's, whether a mental health condition caused substance abuse or vice versa, but I can make the argument that, well, if it's so interwoven, then the tie goes to the veteran. So
right.
That I would say is definitely something that can make these claims easy for the VA to just kind of put aside or not spend enough time on.
Right. I talked a little bit about the challenges that our Vietnam veterans faced, and I think that some of the new challenges that some of our modern day veterans are gonna face is opioid addiction and addiction to painkillers and what led to those addictions. I think that we're going to see a lot more on that in the future. I think we already know that this country has undergone an opioid crisis. We're seeing overdose deaths, the highest numbers since the 70s. is what I've read. And unfortunately, a lot of our veterans are falling under that category, because they do have chronic pain conditions, whether it be due to a back injury or a knee injury or some other kind of, physical ailment for the most part. And they've been diagnosed these medications, and then they've just been continuing to be increased. And that then creates an addiction. And that has, I've also seen that then lead to all these other problems we were discussing, like homelessness, like, family issues, overdoses, which aren't always fatal. But I do foresee that that's probably going to be the next big challenge. We do a lot of mass torts, and I already see the writing on the wall that that's kind of the direction that we're going in, for these veteran claims. And so I guess along those same lines, do you feel that same kind of advice, if it's a physical condition that they're contending with that led to an addiction to painkillers or or an opioid addiction, that they too can be successful in their disability claim despite those issues?
Definitely. So there is a case that we're working on where the veteran passed away. So it's a DIC, dependency and indemnity case with the widow, where one of the factors was that the veteran passed away through, it wasn't necessarily an overdose, but over medication was kind of part of the issue. And it was a history of, doctors prescribing him medications and through no fault of his own, really taking too many, and developing an addiction or just reliance on these pills. And so that's something that, we've already seen cases like that. And it's, again, proving that whatever problem, whether it be, we don't want to see if a cause of death or if it's some kind of severity, functional impairment, just relating, if that's the result of some kind of addiction or substance abuse, having that medical evidence to say, well, this developed because of something that's service connected, or something that should be service connected. So if your back is service connected and you've been taking painkillers, a lot of times we will ask veterans, what kind of side effects are you having from your pain medications? Focus issues, fatigue, things like that. That all plays in with, well, not just physically can you work, but the pain meds make it where mentally it's not safe for someone to be working. So that's definitely, you see it in cases, not just mental health.
Right. Okay. Speaking of the which, can substance abuse be considered secondary to a service-connected mental health condition? And along those same lines, can you get VA benefits for a substance abuse disorder?
So not for the substance abuse itself, but in effect, you're saying that the substance abuse is secondary to a mental health condition, because then any residual problems or anything related to the substance abuse, for example, there was a case that we had where a veteran had cirrhosis of the liver. He was service connected for, I can't remember what, but a mental health condition. And so to prove service connection for the cirrhosis of the liver, we had to prove that the substance abuse, his drinking problem, was caused by his PTSD. And so in that sense, the substance abuse, technically speaking, you're saying it's secondary to something. You're not actually going to get service connected for a substance abuse problem in addition to a mental health issue, but having it related to the primary diagnosis, is something you could think of it as secondary service connection, basically.
Okay, great. Well, this was very helpful, Anne. Thank you.
Thank you.
And thank you all for joining us. We hope you'll do so again. In the meantime, if you have any questions or concerns, please feel free to visit our website or call our office.